Hello everyone, I'm Brittany, and today I'm thrilled to be joined by Prof. Dario and Prof. Andy Poe for a conversation on One Health. One Health is more than a concept. It is a blueprint for resilience across integrated systems of life, linking health, environment, and technology. In this conversation, Professor Paolo Dario, a global pioneer of biorobotics and health innovation, Professor Andy Poe, strategist, executive, and advisor to leadership on transformation and the future of healthcare, explore how ecosystems thinking, intelligent technologies, and interdisciplinary collaboration can converge to shape healthier, more sustainable futures. Together, they reflect on innovation gaps, new forms of integration, and the pathways to embed One Health into the systems of tomorrow. Professor Paulo Dario, honored as the father of biorobotics, is emeritus professor at the Biorobotics Institute at the San Anna School of Advanced Studies in Italy. He innovated techniques in the practical applications of robotics in engineering and medicine. He was one of the main proposers of bio-inspired sensors, devices, and medical applications of robotics at a time when they were unknown to most roboticists. His pioneering work in tactile sensing and artificial perception for robots enabled cybernetic processes that directly interface with the nervous system. He contributed to the development of neurorobotics to expand the capability of human-robot interaction and empower the robot with human intelligence. Professor Andy Poe is an international healthcare strategist, executive, and transformation advisor with a career of senior-level roles spanning government and industry. He advises on system-level transformation, policy, innovation, population health, public-private partnerships, and future readiness across healthcare and impact domains. His current appointments include Senior Advisor to World Scientific and Health System Intelligence, Honorary Professor at the University of Birmingham, and Senior Fellow at Japan's Health and Global Policy Institute. First question is to Prof. Dario. Prof. Dario, to begin, how do you define One Health as an integrated approach, and why should the world embrace it as a critical framework for the future?
This question actually, One Health is the final step for me of a long career analyzing different aspects of healthcare using technology. Biorobotics means bio-inspired machines and bio-applied machines. But there is something more than single and sometimes fragmented fields. Actually, if you consider the case of aging, that is one of the key, actually, problem and dreams of current society, you would see that aging is the combination, aging well, of genes, so a lot of analysis of the say bio aspect of life, but it's also about environment. So living in a healthy environment is fundamental for a healthy aging. Also food. Food quality is a key aspect of living well. But also active life and movement, for example. Movement is a cure for many illnesses. And also social interaction, safe and healthy social interactions are fundamental, working well. And also preventing, of course, illness. And then the hospital and healthcare itself, that is very important, but one of the steps. And then after that is about recovering and reinserting our life into society. So it's a continuous flow of actions and aspects that require an integrated vision. Actually, I came to this mostly because, as I said, for my career, for my research, for teaching, but also because of where I live. I live near to the place where Leonardo da Vinci was born, actually only 30 kilometers from here. And Leonardo da Vinci was probably a very, very interesting example, probably an iconic example of integrating different disciplines about quality of life. So our planet, our human aspect, arts, science, technology, society, humanities, all together form the framework of what we could define One Health.
Thank you for that, Prof. Dario. Prof. Andy, from a systems perspective, how can One Health thinking be translated into practical strategies and operations that integrate across sectors and disciplines?
Thanks, Brittany, for that very important question. And first of all, also thanks to World Scientific and also to Prof. Paolo to be able to join him in this invigorating discussion on the novel concept of One Health. So when you look at the health system's point of view, One Health to me offers a governance framework that aligns the key determinants for health and well-being under one integrated systems lens. And these determinants can relate to health-centric factors, environment factors. I think Prof has mentioned a bit about that, about the context, and obviously technology, given the rapid dynamic advancements you see in technology. Now, to translate it from a vision, practically, a few things are required. So one is cross-sector integrated coordination mechanisms. So to do that, we will need shared data platforms, foresight systems, and perhaps a rethink about the way we classify what performance means, right? So increasingly, we talk about a collective outcomes-based approach that redefines performance and accountability. So the last two things I will say, Brittany, is that the focus must shift really from siloed interventions to what one might term systemic coherence or shared accountability, because simply because there's so many different actors, there's so many different owners across the healthcare ecosystem. And this is important to reinforce outcomes rather than fragment outcomes. And to do this, we need to embed integrated data ecosystems, predictive capabilities. We don't just want to know what's happening right now, but what's happening in terms of demands on the healthcare system in years to come. And one example is AI-driven precision population health models. By that, I mean very precise resource allocation to optimize various aspects and components of the healthcare value chain, right? We're talking about human capital, service delivery, financials, and productivity. And last but not least, an adaptive collaborative governance, given the speed of technological advancements and this increasing new modalities for healthcare delivery. So these approaches in tandem become the strategic driver of future-ready and resilient healthcare systems in line with the One Health concept.
Thank you for that, Prof. Andy. Well, Prof. Dario, as a robotics pioneer, where do you see AI, robotics, and emerging technologies making the biggest contribution to advancing One Health as an integrated system?
Actually, we are now entering the world of physical AI, and so we could consider digital AI that is now very popular and got revolutionary progresses with LLM systems, but with the physical AI. Robotics is part of the second, and both are extremely important for One Health. Consider the case of robotic surgery, for example. Robotic surgery that is a tremendous success from a clinical point of view, also from an industrial point of view, because there are many companies generating substantial outcomes and creating jobs a lot. But AI is also entering the field of robotic surgery more and more. But at the same time, there are other steps, like, for example, rehabilitation robotics or assistive robotics or prosthetics, all including bodies, machines able to perform action. So it's again an holistic approach. AI for data, for simulation, for anticipation, but robots for physical intervention. And this is something that is more and more happening. For example, consider I'm working now on one new aspect that is integrating surgery with rehabilitation. The two fields are usually separated. There are departments for surgery and then department for rehabilitation. Actually, I believe that, and this is clearly an aspect related to One Health, if you will. Of course, there is more than that, but integrating smoothly the intervention part with the rehabilitation part. This can be done using data and using, of course, a new paradigm of AI, but also integrating robotics. This is going to, and this is just an example, but there are many, many similar cases in which integrating digital AI with physical AI and more, social sciences, human sciences, the centrality of human being, the centrality, of course, of the planet, altogether can make a real change into healthcare worldwide.
Thank you for that, Prof. That was very insightful. Well, Prof. Andy, your work often bridges data and population health. How can predictive analytics and intelligent systems help turn One Health from vision to practice?
Thanks so much, Brittany, for the question. I think I just want to pick up on one or two points which Prof mentioned. So it really goes down to the heart of how we turn insights into action. And Prof mentioned two important things. One is obviously the AI, advancement of AI, and that's obviously transforming systems. But the second thing is data. So really the power of predictive systems lies in the ability to translate very complex data, large data sets, into anticipatory intelligence. So this includes the detection of early signals, forecasting trends, and by that, then you improve the speed and quality of data-driven decision making. So that's one. So with these future fit capabilities through AI, through data, harnessing the power of data, as it were, systems can then move from reacting to, for example, crises or even black swan events, to preempting these contingencies and black swan events, which might otherwise have catastrophic consequences if we don't prepare for them, right? So what do we need then? So in line of the important role of data, we then need, as highlighted by Prof, so we then need integrated intelligence infrastructures that connect data across domains. So it's not just healthcare data, but environmental data, social data, even economic data into perhaps unified dashboards which drive evidence-based governance. So, Brittany, and I'm a proponent of emerging technology and AI. And I think that we are at the cusp of transformation. So AI-driven foresight tools, they enhance the capacity for early detection and resource allocation. So I was speaking about precision population health models. And this allows whatever interventions we want to put into a health system to be timely, targeted, predictive, and scalable. So ultimately, to turn One Health from a vision, strategic vision, as it were, into daily data-informed governance, we need to build in the interoperability of systems, the adaptiveness of systems, and to also enable anticipatory design with data and continuous learning as part of the system design. So just following up on a few points, important points raised by Prof.
Thank you, Prof. Andy, for that. Well, Prof. Dario, One Health is about breaking silos. What new models of collaboration do you believe are essential to make this integrated approach a reality?
I'm a strong believer, I've always been that, of interdisciplinary education. I mentioned at the beginning that I live in Tuscany. That is where the Renaissance was born. Renaissance following humanism is an iconic event that essentially changed the way in which the human and the planet were integrated by observing facts from different points of view. This is an inspiration for education. I believe that students should be educated not only to be focused and expert in one single field, but to look at problems in an integrated manner, knowing about history, about anthropology, about psychology, but also about sustainability, not just economy, because, for example, engineers are most educated to know about very, very focused technical issues. That is very important, of course, and maybe economic issues. But there is something more. For example, today, because one problem of healthcare today is cost, so sustainability for government. And many people are fighting to make high technology available to everybody, but this is really an issue, very difficult. So how to address this? Again, probably with the holistic approach, integrated approach. Actually, I invented some years ago, and I'm still working a lot about something different than high tech, high cost. Today the approach of technology is high tech, high cost. In developing countries, there is the opposite approach, low tech, low cost. I believe that the real challenge, and the One Health approach can help a lot, is high tech, low cost. And in my opinion, this is possible by putting at work all aspects, not only technology, but also integrated vision. So how to make the best technology available to most people, making this affordable by government and by several users. Again, it's putting humans, but also the economic system and the healthcare system at the center, with innovative technical approaches that are possible to pursue.
Thank you for that, Prof. Dario. Definitely something to think about. Prof. Andy, you've often highlighted the role of networks and partnerships. How can these be reimagined to support One Health ecosystems across health, environment, and technology?
Thanks so much, Brittany. I'm really glad that Prof mentioned a few important points. So he mentioned interdisciplinary, and actually that in many ways relates to partnerships, because partnerships and collaborations are really the sine qua non of an effective healthcare ecosystem. We need to move beyond project-based collaborations to what I would call platforms-based partnerships. And Prof was talking about the increasing accessibility of technology to reduce costs, to make it affordable to various segments of population. So we need increasingly ecosystems that are continuous, data-enabled, and adaptive. And that can only come about from collaboration between different players, right? To form long-term platforms which connect government, Prof mentioned government, but also the funders, the payers, academia, which is very important, and also industry players. So what we then end up having is open innovation and coordinated governance, which sustains sense-making, foresight, accountability beyond any single initiative. So what we're talking about, a sustainability of presence, of accessibility of healthcare services, as Prof mentioned, high tech, low cost to segments of population. The second thing is that we should embed analytics. So this is building on the subject of data, because we need data, we need analytics to have learning feedback loops, right? And also we need it to feed foresight capabilities. We can then create living systems of innovations, networks which are neural, which evolve and grow smarter. So Prof mentioned, for example, the physical AI realm, for example. This is an ever-burgeoning, advancing area in terms of healthcare and also science, technology, and research. The second thing I think we also need to have in terms of partnership is to have experimentation platforms where we can have foresight labs, and this allows data to be formed, so i.e. shared data alliances, and this helps to bridge the gap, I think, between research in its primary phase, but then also policy and real-world implementation. To have real-world implementation before we scale it to hit larger segments of population is always interesting, and I think very useful to basically have experimentation platforms and grounds for that. And I think last but not least, I would also mention the importance of trust architectures. So by that, I mean frameworks that reinforce transparency, data integrity, and shared accountability. So this should be inbuilt in terms of the new generation partnerships. And together with innovative funding models, so we touched on making care accessible. So we need innovative funding models which are sustainable in the long run. This will then sustain resource alignment, but also institutional memory, meaning to say that ecosystems can endure between an episodic lens of just one initiative, but really a sustained presence of One Health across various partnerships at various different levels in an integrated way. So that's how I think I'll build upon the important points that Prof has mentioned, but I think essentially partnerships need to be tangible. They also need to be future looking. They need to enhance and incorporate and harness the power of technology so that you can reach wider segments of the population.
Thank you for that, Prof. Andy. Prof. Dario, if we think of health as an ecosystem of systems, what elements do you see as most fragile today, and how can their resilience be strengthened?
I think that a fragile element is education first, because we are getting out of an age in which specialization and sometimes silos, as was said, were a must, into a new era in which the world and also the human society are considered as they should, that is, in a very integrated manner. But in order to do that, of course, there are many fragile, weak subsystems, but at the center of all, there is the role of human. Even AI should be moderated, should be controlled by humans. So we need to invest a lot in education, because educated people at all levels, professionals, of course, because we need scientists, we need technologists, we need industrial people, we need administrators, we need government. So understanding the complexity of problems is a key. And as an example of this, I want to mention the European programs. European programs, even if Europe has some difficulty now, but were, in my opinion, a very, very interesting example of collaboration. So Europe has 27, 28 in sometimes different countries, different cultures, and a very, very successful effort that was pursued is to exchange and integrate these different cultures, different sensibilities into some joint initiatives. One could say, and this is true, that this system may not be totally efficient in terms of getting real results, but it is in the long range very, very fruitful, because it has created a common ground for people. Programs like Erasmus have educated millions of young people who then, after many years sometimes, they meet together, there are connections that are unique in the world. So I think that it's a very good example of collaboration that, even if in current geopolitical situation, this is not easy, but in my opinion, this should be pursued in healthcare. Again, we are living in the same planet. We are all the same as people. So sharing information, sharing data, sharing good practice are fundamental. So culture, putting culture at the center, not just technical education, but real culture, in my opinion, is fundamental to manage what are the challenges and to take advantage of this integrated approach. Especially, the Z generation, the young, are very, very sensible to that. They are looking at problems, considering more ethical, social aspects sometimes than just economic. And I believe that this is a very interesting point to consider, because the market will be based on young people, of course, in the future. And it's important to invest in them.
Completely agree with you. Thank you for that, Prof. Dario. Prof. Andy, looking at the wider system, how can foresight and anticipatory approaches help us prepare for new risks and opportunities within One Health?
Thanks, Brittany. Important question. It relates to what Prof also mentioned. This is, we're talking about a more encompassing approach on inputs of perspectives, right? So into a more inclusive approach, as it were. So this is really an important question on future planning. So I would say a few important points amongst the many. So one is that foresight enables anticipatory governance, right? So it embeds preparedness, adaptability into how systems are designed, governed, and resources, shifting from reactive crisis management to proactive readiness. So I think we all acknowledge the importance of foresight in that. Now, the second thing is the horizon scanning, which is part of the foresight process, will then be able to identify emerging risks, but not only risks, but cross-domain risks. As I mentioned, outcomes of the healthcare system, population well-being, population health outcomes, not just dependent upon health-centric domain, right? We're talking about cross-domain risk and opportunities we need to think about, right? Including climate, digital demographic dimensions. And this allows policy makers to detect early signals early and then to translate them into strategic insights. So one of the early signals, for example, will, be from the perspective of youth, for example. How do they view the world? What's their worldview? What's important to them? For example, the Gen Alpha of today will be the working adults, or the young generation today will be working adults in generations to come. So the third important thing is that is the element of scenario planning. So scenario planning and thinking about the various dimensions enhances strategic agility. Now, this is important because it helps policymakers and innovators stress test assumptions, right? And it also allows the alignment of long-term investment with policy and innovation pathway. And at the end of the day, I think increasingly in healthcare, we are focused on building what we call future-ready institutions, right? Future-ready institutions are those that ensure that today's, data fragments, foresight signals that captured, they're interpreted, and then they're transformed in some kind of intervention to prepare for example, the future health population demand or the future health issues of tomorrow. So in short, it is about facilitating intelligence, transforming it into an actionable intent, and to inform tomorrow's decisions. That's probably the best summary I can speak. I can state as it is.
Yeah, another question to Prof. Andy. What might success look like for One Health? And how might we measure the progress along the way?
Yeah, I think this is a good one. This is a segue, perhaps. The two questions are interlinked. And I see the vision of integrated systems, which is what One Health embodies, really to be success, to be integration becoming systemic rather than symbolic. That's the first thing I would say. So there must be tangible action to translate this integrated vision into a practical working model where cross-sector principles are institutionalized into governance, right? Embedded in policy design, system planning, accountability structures. That would then represent a mature integrated ecosystem, which obviously brings together not just health considerations, but the environment, technology as powerful levers for well-being and population resilience. So that's the first point. The second point, to guide us towards that eventual outcome, it is always useful for there to be some kind of performance measure, right? So being from the healthcare system, we like structured indicators. So a few structured indicators, perhaps as a suggestion for discussion, could be indicators which reflect system integration, right? So system integration indicators may capture the depth of cross-sector collaboration, interoperability, data connectivity across different domains. So that's one kind of indicators. The second kind of indicators would be resilience scores to measure effectively how systems are able to anticipate. We mentioned about anticipatory design, absorb and recover from shocks, for example, ranging from pandemics or climate events or digital disruptions. So that's another kind of performance measure success. And the third performance measure success, I would say, sustainability and equity indicators. So sustainability meaning to say that whatever new system, integrated system we have needs to last towards the future sustainably, right? And equity indicators would really I think combine a few considerations. One is the focus on human well-being as a key outcome, environmental stewardship, and inclusive growth. I mean, Prof has mentioned also that we need to, for example, take into account the perspectives of various segments, especially the youth who are the future of tomorrow. So at the end of the day, I think the vision of success will be defined by future-ready healthcare ecosystems, which co-design, which continuously learn and evolve together with different key players from the ecosystem alongside advancing technology. For example, like the physical AI realm that Prof was mentioned, the robotic human interface. These are increasingly becoming part of norm, as it were. And I think the one of the considerations there to see how do we democratize access of the new technology-enabled services to all segments of the population.
Thank you for the insight, Prof. Andy. And finally, Prof. Dario, if you're speaking directly to the next generation of innovators and system designers, what advice would you give them to shape One Health future?
Actually, I do this every day, because I'm lucky that the institute that I founded has now more than 380 people, including something like 150 PhDs. And PhDs are the real innovators in different areas, in science, in technology, in industry. So the key message I give all them is, first of all, to learn about the past, because there is there are some people who deny the role of history, say history like about dinosaurs, but actually history is a master of life, as the Romans said. And having worked continuously for almost 50 years in research, I'm so glad to see what were my dreams when I started my career to become a reality. If you consider what healthcare can do now in, for example, surgery, but imaging also, or drugs and minimally invasive interventions, rehabilitation, prosthetics, is unbelievable. So I'm so glad and honored to have contributed directly or through my former students to do all this. So this is the first message, to understand and appreciate the incredible progress of medicine. Just 6 months ago, I had a cataract intervention in my eye, and that they put a small lens. But just 20 years ago, people became blind for cataract. And today, this is something that is done in a few minutes, thanks to technology, imaging, material science, robotics. It's unbelievable. And this should be known. And then what is the next step that I recommend to my students and also colleagues, young colleagues, to try to predict the future? Because there were many, many events. I mentioned just two. One is the introduction of the iPhone and smartphones, just 2007. And this determined the revolution of social media, a real revolution that was not predicted virtually by anybody. It came. And the problem is how to control that. So we are reacting to innovation. Or now AI. Nobody had predicted, but it was introduced in 2022 by OpenAI. And then it's a revolution now, not predicted. And so the action of government is to regulate. But the real challenge is to understand what will be next revolution. For example, I predict that next revolution will be physical AI for robotics, because it's obvious that together with digital AI, there will be the role of actors, of robots or machines that can do things, not only process data is coming. I'm making an example, but there are many others. So innovators should not only understand and use innovation done by others, but also try to explore new things, but also keeping responsibility of what is happening. So what will be the impact of their innovation on humans? What will be the impact on the planet? This is the way to go back to interdisciplinary education, so understanding the consequences. Personal responsibility also of innovators. And I believe that the new generation of the young essentially are very sensible about that. They understand, they want this. So it's an incredible challenge and incredible opportunity. And following the One Health approach, I believe we can do better than we have done with a fragmented approach that still led to extremely valuable results, but something better can be done. So I'm a strong believer of this One Health approach from the scientific, technological, human, and sustainable point of view. And I believe that government, decision makers should think of and probably adopt this idea more in their decision taking.
Thank you so much for that, Prof. Dario. I'm sure the next generation of innovators will keep that in mind. Thank you so much for your time from Prof. Dario and Prof. Andy. It has been such a rich and thoughtful conversation. Thank you for sharing your perspectives with us today.
Very much. Thank you very much, Prof.
Thank you.
Thank you.